Hello and welcome to Health and Wealthness, your guide to the integrated personal and financial retirement journey for physicians. I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. Welcome back to this week's episode of Health and Wealthness. Today I am very excited about our guest. It is Dr. Rob McGregor. He is the recently retired pediatrician and chief medical officer from Akron Children's Hospital, and will be doing a continuation of career as the professor of pediatrics at NeoMed University, so Northeast Ohio Medical University. And with that introduction, Rob, welcome to the podcast.
Thank you, Michael. I'm looking forward to it.
Me too. And to give some of the listeners a little bit of context and background here, our relationship has spanned coming up probably close to a year now, and started while you were still actively practicing medicine.
Absolutely.
And a recent celebration here within the last couple of months is you've now entered retirement.
That's correct. Not quite a month.
So congratulations on that. And most importantly, the friendship that we developed along that timeline through our coaching relationship. And so maybe we'll start with that, talk a little bit about coaching, and then really in this week's episode, we'll dive into that final phase of your employment and talk really about some of the tangible things that you did to prepare for this retirement transition.
Sounds great.
Excellent. Well, let's start with coaching, Rob. We've obviously developed a significant ongoing relationship over this, but tell me a little bit about how coaching has enhanced your retirement journey.
Wow. That's really, it's been a profound effect. I think the tools that we gained and had to use and practice with each other and our other classmates are really excellent forced moments of reflection that I won't speak for all physicians, but that's just not something I took the luxury of time to do. So going through the exercises, especially, starting off with the values, it gave me so much clarity as to how there were points in my career where I really thought I wanted something and I was force fitting it and I was miserable. And now when I look back on it, it's like, well, duh, it didn't align with your values. So, I had many of those aha moments over our I guess it was more like 7 months worth of experience as we did the prerequisite work together too.
Yeah. And I guess you pointed that out. One of the activities is actually mining out those values from positive experiences. What went well? Why did it resonate with you? And maybe reflecting on those negative experiences too and saying, why didn't that resonate? And what value was that in contrast to? Once you have those values as that centering piece and that foundation for your journey, how did having those values clearly defined help with your journey?
Whenever I would be stuck or I was feeling like I was at a minor crossroads, I would pull that sheet out and reflect, what am I honoring? Which of these values am I honoring? And if it's none of them, is it really something I should be spending my remaining time doing? And it's amazing how much you can call your activities when you recognize, especially if you're stuck. If something's working, I don't really perseverate, but after the fact, go back and look and say, why did that work? Well, it really aligned and it gave me the more time to do the things that give me joy at work. So that made great sense for me to continue to work on my not-for-profit, for instance.
And you mentioned bringing joy at work. So now you've got these values aligned, projects, activities, and role. And I guess, can you kind of talk us through maybe the last 90 days or final 6 months or final few years of your career as CMO?
Sure, I'd be happy to. I want to give you a little bit more background, though, because I don't think, I'm sure as many of you are aware that, a journey, one journey. And I've been gifted. I had a very forward-thinking CEO come into the organization 3 years ago. We established a pretty effective relationship, and I challenged him that I wasn't going to have the longest runway with him on my part, because I really had set a date in my mind that before I turned 70, uh, I wasn't going to be working 24/7. And he gave me that latitude, and I was able to groom several potential successors. And we really staged this so that 6 months prior to my departure, we would name the successor. And it turned out we ended up we divided the role up into three. And I still tease him that, gee, if I knew I was worth 3 times as much, I might have deferred a little bit. But that wasn't really part of that wasn't part of the calculus in his mind. But so I preface it with that. But I realized, I'm very much left brain. I really, I can remember one of our first exercises where we shared and had to do metaphors. It was killing me. Like that's not what I do. I do evidence-based practice. I know this is how I do medicine. This is how I do business decision making. And I really found, again, through these 6 months of coaching, that was really not the last 90 days, but really, really kind of influenced my ability to see things in a different manner. So I really took on first looking for evidence. And I know many of us have read the first 90 days on the job. And I was searching the literature for the last 90 days or the last 100 days, and I couldn't find anything. And I actually reached out to, I was having my one-on-one with the VP of HR and communications. Then I asked him, I said, is there a book? And he said, no, there's not. Do yourself a favor and keep a diary. So that was one of my activities at the end of almost every day. I'll confess, there were some times where there was 3 days where I'd say, oh man, what happened over the last 3 days? That I would take inventory of how I spent my time, what I was doing, and what did I deliberately want to do. So I think in this last 90 days, it was a gift. I had already had 3 months of my future successors assuming parts of my roles, and I could coach them through that work, offer them alternatives or unintended consequences or whatnot from their decision making. But I could back off and be reflective. And I started to deliberately create closure with people that I felt I may have been more judgmental than I should have been, or people that really bailed me out and I wasn't sure that I had expressed enough gratitude. So I tried to deliberately inject that into at least one of each every week for those last 90 days. And it ended up being a gift in and of itself.
Well, what an amazing story to take us from 3 years out. I've got my goal, got my 3-year goal of being retired by 70. And then to have a newfound CEO come in and provide you that latitude, and then drill down with a 6-month succession plan and record those experiences within the last 90 days to the tune of, if I can celebrate you a little bit here, a clap out. And it sounds like that is an amazing celebration of your career, not just closure, but celebration. And what I've learned from you in coaching is celebrating is a tremendously large part of the experience. So let's talk about that a little bit.
Well, I'm glad you of all people would bring that forward, but I won't disclose anything that was confidential.
We're working on it, Rob. Everyone can appreciate. I ask the physicians that come on this podcast to be vulnerable, and there's power in that. And so the reason I'm asking you to celebrate with me here and to share a little bit about what that is in full transparency. Rob has shared that with me in coaching. He's taught me to celebrate the wins and the milestones and to really focus in on the positives, not just fixing the negatives. And so if there's anybody to talk about it, Rob, it's you. You've taken someone who is quite rigid in my own thinking and really challenged and helped me reframe that. And so if anyone to talk about it, I think it's you. So share a bit about the power of celebration.
Well, I think this is true of any driven professionals, but I can only speak to physicians. And I know that most of us, if we got a 95 on an exam, we would perseverate over the 5% we didn't get right and think, how could I be your doctor and have a margin of error? That's not Six Sigma. That's not even close. Uh, so I think perfectionism is rampant. And actually, there's a fair number of us that aspire to perfection or expect perfection. And I've really come to realize that perfection is to be managed. It's not to be. It's not to aspire to become. It's really something that we need to manage it. And instead of, again, I don't want to miss that 5% and create a problem with one of your kids, but recognize that there's a heck of a lot of good stuff that I didn't know in that 95%. And I know that pretty well. So I'll play to my strengths and I'll ask for help, which again is something that I think as a profession we don't ask for help enough.
I think that's powerful. And maybe, I share a story here from our coaching program where they were speaking with someone from a pediatrics hospital who had been in the emergency room. The physician comes in, a child is choking, and they're able to clear the airway. Child ends up surviving. And the physician, once the child is stable, says, okay, I've got to run to the next thing, right? It's the emergency room, and there's literally no time between this event and the next. And one of the APCs or APPs who was a coach actually asked the physician, could we pause for 15 seconds to celebrate this? And you could think in a day, 15 seconds might feel like a lifetime, especially down in the emergency room. And even that 15-second pause allowed the coach to say, how will the child's family feel today? You have a mother who doesn't have to mourn the loss of a child. You have a teacher who doesn't have to worry about an empty desk tomorrow at school. And I think that powerful story, that chance of, physicians are experiencing some tremendously significant events in their career. And just that 15 minutes of reverence or 15 seconds of reverence can be so powerful.
I think you make a great point. I'm a big fan of Tate Shanafeld and the really forward thinking work he's done for the last decade and a half in physician wellness and recognizing some of the system problems, which this doesn't approach, but some of the other elements that feed into burnout. And he's shown really, literally, if you can get 20% of your effort, your work of the week or the month, or whatever, however you want to break up the calendar, you have significantly reduced your risk of burnout.
Mm.
So I think that you take those 15 seconds and you do several of those every day times a year, you're not going to get 20%, but you're going to have a significant chunk already built in. And then you add the stuff that you deliberately put into your work so that you can enjoy what you do.
And what do those celebrations create? Because when we're adding on top of an already significantly stressful career as a practicing clinician, this retirement transition on top of it, we've now got emotionally charged career with high intellectual and emotional demands on top of this daunting transition and what often feels like this terminal nature of retirement. What do those celebrations do to make that journey a little bit different?
That's a great question. Um, I think the power of positivity really unlocks potentials that we don't have in our in our rigid scientific brains. Um, and for myself, I did coaching because I thought, well, that would be an interesting way. I've coached people informally, not the formal way we do it, for decades. As a residency director, as an interim chair of a department, as a division leader. Like I've done this, And I thought, well, maybe I could do this a little bit better, and it might be something I can do moving forward. Little did I know that it would really became it would become my goal to retire to, in addition to retiring from all the other great stuff that I had the opportunity to do.
I love that concept of not just having something to retire from, but something to retire to. And I think in next week's episode, we'll really dive into what you were able to retire from, maybe some of the stressors, but a little bit more about that deliberate transition as you were building out what you're retiring to as well. And so, for those of you listening, we'll really dive into that, not just retiring from, but retiring to in the next conversation. At the end of this one here, Rob, I've got one more quick question for you, and
Sure.
that's really on these last 90 to 100 days, and that journal that you kept. What was that for you emotionally and as a tool? How did that help tell your story on retirement?
As a tool, it held me to my goal on the front end to really look for opportunities to, I don't want to make it sound like I left bodies in the wake as I was,
Yeah.
progressing my career. But it gave me some accountability that I could see in writing that, whoa, you didn't really reach out to anybody. Did you not cross paths with anybody that you might have been a little dismissive or a little impatient or, more demanding than was realistic? So it really helped keep me centered. Um, and it helped me celebrate. I actually did write down, some positive activities that happened when I was coaching some of the people as I got more versed in the art of coaching. I actually shifted my regular fixing and counseling to really improve on having the coachee, that individual in front of me, see the wisdom and figure out their route better than, or maybe the same as what I would have imposed, but they could own it. So it really, again, I'd love to say I did it deliberately. I didn't. It just happened to reinforce what I was doing with the coaching part of my journey.
Well, I want to use that opportunity as listeners who have been listening for a long time have heard a few times now, but again, just for the first time listeners, there's a very strong difference between coaching and advising or coaching and mentorship. And we've talked about that, and we'll probably talk about that more in detail in the next conversation here, Rob. But maybe just creating that delineation real quick between coaching and advising, and how advising is a little bit more about leadership from the front with those behind, and coaching is a bit more about walking side by side, about guidance and empowerment and introspection. I guess could you share about that a little bit?
Yeah, I think, many of us as a physician, your goal was to go in, make a quick assessment,
Mm.
try to say, well, all right, what is this not? What's the worst case scenarios? Okay, let's check all that off. Now, what do we need to do? Here's a plan. Let's do this and move forward. So we're bred 40 years of fixing. So it is the quick, efficient way to solve a problem.
And it's
It's
what
not
people pay you to do. I mean, it's what you're being paid to do effectively and efficiently. So let's call it what it is. It's trained in and it's bred in and it's enforced for 40 years because that's the right approach for that interaction.
right. Again, to use your airway problem, we don't have the luxury to like say, well, what do you think, Mr. Schwartz? What would you like me to do next? It's like, yeah, just sit there, Dad. I'll fill you in a minute. Boom, boom, boom. Uh, so I think what the major difference is really we start without when we start with a patient, they come to us with a problem. When we start with a client, they come to us with an opportunity, but they don't always see it as an opportunity. They see it as something's not working right for them in that setting. And assuming they're capable and whole, let them tap into their creative energy because my solution might work for many, but it may not be what you were looking for. And I may not quite have nailed your concern. until I shut up and listen, which is something that as a fixer, many of us interrupt the family before they've got 20 seconds of words spoken. And that doesn't really help patient-centered communication either. So it has got another benefit. I did find that in my last 100 days, I still had weeks when I went on inpatient medicine as a hospitalist, and I was different. I think I listened a lot more than I have, and I think I'm a pretty good listener. I was a diagnostic dilemma doc for about 6, 7 years of my career, where I was seeing the kids that nobody else wanted to see or couldn't see or didn't have time because it was not a straightforward problem. So I really prided myself in thinking I was a pretty good listener. But again, I've been humbled, and I can continue to improve even with that. So I think the big difference, to answer your question, is, advising is saying, look, I've been around a long time. This is what I do. I've seen this. This is probably the situation. And would you like to try this? As opposed to, so have you given it any thought, Michael? Have you ever seen something that put you in this fix and you navigated it? What worked for you then? Or do you have any resources that you can pull on as you walk this walk? And you may or may not. You may say, well, I need to get some resources, or, oh my goodness, I have this guy down the hall. I didn't think to talk to him about it. So again, it just opens up other ways. And what I find most valuable is helping people reframe what they're facing. And instead of going to the, catastrophizing and going to the worst case scenario, which again, as a doc, I don't want to send you home from the ER if something really horrible is highly likely to occur. So we're actually bred to be catastrophizers in some ways too. But when we're solving problems, especially when it's about our career or our satisfaction doing what we're doing, or even our home life, I think it's really valuable to help them reframe it or look at it with a different lens.
Yeah, and one point that you mentioned is you creating a solution as the coach or advisor may not resonate with the client as much. And I think that ties right back into the values-based conversation. The right behavior might be motivated by top five values between the coach and the client. And so an advisor would come in and say, here's what you're doing and why it might make sense from my perspective. But someone might come to the exact same action conclusion for 5 different reasons that align with them, but unleashing the power of belief within that values alignment, as you mentioned, and then that resilience, because we've seen it work in the past. What do we need to mine from our experiences? That creates resilience, that creates empowerment, that creates momentum, positive momentum with values aligned behavior. I guess what about that resonates with you when it comes to the coach-client relationship?
Oh, it all resonates. I mean, you can actually see the physical characteristics of the person in front of you change from someone that is downtrodden or anxious or darting gazes to someone who looks you in the eye and takes a big breath, and you can see that that you get the feeling with the mirror neurons that you've helped them move. And again, this isn't about the coach, but it does give me more than 20 minutes of joy when I'm coaching people if I see that, look at that, they're moving, and I really just shut up and listen.
Yeah, you created an environment for someone to kind of mine through some of the thicket and create this path forward that they've identified for themselves. And as you found on your retirement journey, there is no shortage of new thicket. It's popping up constantly, and for anyone in healthcare, I'm sure they see it in their career. But as we look to next, we certainly know the thicket that we're looking to get away from as we're retiring. Right? Several physicians know here's the laundry list of things I'm looking forward to retiring from. And in our next conversation here, Rob, let's dive into kind of what you're retiring to.
Okay.
Um, So we'll put a bow on this episode. A quick recap. You made a conscious decision to retire by 70. You had a phenomenal 3-year unleashing, if you will, of this process of retiring with a very strong roadmap for the 6-month onboarding of successors and delineating that CMO role to not just one or two, but 3 successful up and comers within the Akrons, and a little bit of how that closure brought about a sense of peace in light of a very daunting transition. I would say, was it actually easy, even though you had a plan and all of these things in place? Did it make it any easier? And how easy was it really to retire?
It definitely made it easier. But I'd be lying to you if I told you it wasn't bittersweet. I'd be lying if I told you there were not tears. Now you're getting me choked up here, buddy. When I actually did retire, I put something on LinkedIn because I thought I wanted to legitimately say I'm retired and retiring. And I wanted to use that as a broad way to thank all the families and nurses that kept me from doing stupid things, and administrators who really taught me the administrative part of medicine, an administrative part of running a business. So it was really an opportunity to express gratitude. Well, the number of people that have written to me, it continues to like pile on. It's not the right word, but it continues to accumulate, and gives me opportunities to have closure or express gratitude to those people who took the moment, read my lengthy diatribe on LinkedIn, and said, "Wow, yeah, I think you also should have told us about this," or like they wanted to edit it, which is fine. But so it was, all in all, it has been a very, very positive. It was much more positive and easier to be going to something in addition to closing the door on something that I loved, patient care, the one-on-one, making the kid with a serious disease, improve before they had to go to the ICU, or making the child who has some other emotional things that are contributing to more pain than you or I might feel on this given day, and help them walk their walk to go back to school and play to their strengths, do what they do well, be a normal kid. I love doing it, and I'm going to miss it. And I still, fortunately, I've got 3 grandkids, and their parents are very accepting of the fact that I'm recently retired and not, I'm not that outdated yet. So I'll play that for a year or so, and then I'm probably going to be, "Oh, Dad, that's not what we do now." but I'm going to play that to help me bridge that potential loss.
Wonderful. And I guess what I'm hearing is, while it made the transition easier, reality very much still had a say in your experience, and not just the obstacles, but the opportunities too, to do some of this retiring in public, to make it a celebration, and maybe offer people that opportunity to celebrate with you, to share those stories, to give you the high five or the clap out on the way out. I mean, there's almost a selfishness to doing it privately. And maybe it's withholding the opportunity for others to share those stories with you, those validations, and create that closure 2 ways.
Well, I think you raise an important point, that celebrating isn't selfish. It may be, I sometimes I do feel a little narcissistic about it as I read the comments people put in. "Oh, there's comments today." But it really does give people, and it's funny. I've admonished peers and fellow administrators for not letting us celebrate their careers and their departures. And I remember I bullied one CFO into, I said, "Look, we won't go to a restaurant, we won't do something at the hospital, but will you come to my home?" And he said, "Well, I would do that." And then we had more people there than he wanted, but that was my doing. But again, you know, we're not good at being graceful or forgiving of ourselves. And I think that's very true in retirement, that it's okay to celebrate and get those 95% that you did get right, and get some credit for it, even though it's not about credit, it's about the proper outcomes. But I think that was part of that experience. And it's okay to let people don't push it back, which is reflexively what I've always done.
Yeah, and I really want to dive into that deeper, and we'll make this our last deep dive here, Rob.
All right.
How easy it is to push those things away, either out of deflection or necessity. Hey, I've got to keep dialed in,
Right.
straightforward. The march is so fast, the pace is so swift that out of necessity to have efficacy in my career, I need to put that aside. And I've heard others say they have literally put aside boxes and boxes of things to unpack when they retire, not just physically, but emotionally.
Compartmentalization is something that I was taught to do it in my training. You're working in a neonatal intensive care unit. Your patient dies, a part of you dies, but you suck it up and go to the next patient, because again, grieving with a family has value for the family as long as you're not making them feel sorry for you.
Mm.
But you've got to move on to the next one so they're not grieving and you fix the problem. I can vividly remember there were 4 kids in the sickest part of the neonatal intensive care unit that I was caring for, and 2 of the 4 died within 36 hours. And I just kept going. I just tucked it away. And then several months later, my wife and I were watching something stupid on TV, and I just found myself a mess. It came roaring back, and I was processing those boxes that I thought I had packed away, and I did. I mean, I functioned at a very good level as a trainee, but I don't think that's necessarily the healthiest way to survive, is to compartmentalize indefinitely. Put it aside, but maybe we need to find a better way to build in self-reflection, or make that a bigger part of the culture, so that the dam doesn't roll over and you weird your wife out when you're crying over an undercover boss or something.
Well, you always bring comedy to very serious situations, Rob, but I'm sure as listeners are tuned in here, that they're feeling that in their career. They've lost patience. They've been a part of care teams with things that don't go according to plan. And what better time than this retirement journey to do that celebration, the mining, the uncovering? It gets covered by the sands of time. And whether it's the things that still need to be processed to just carry a lighter load into retirement, or to celebrate some of those wins, to re-stoke the fires of passion that can be stifled by a career as a practicing clinician. It, it just sounds to me like you walk those walks and know the power of being intentional about having these plans, and maybe forcing yourself to go a little bit outside your comfort zone and really turn things over as you close out your career. It's the perfect time.
I think you're right, and I don't think it's a little bit uncomfortable. I think it's frankly outside. It's not a little bit outside my comfort zone. It was a new territory in many respects, and I think a lot of my colleagues feel the same way.
Well, for those who are in that same position, and it feels a little bit daunting or too big of a mountain to climb, too big of a monster to face, any recommendations for them on the other side of that now?
Well, I wrote this in one of my recent drafts and musings, and thinking about retirement. But it was a gift for me to learn to coach. And my advice is, if you're thinking about retiring from whatever you're doing now within the next even 3 to 5 years, And I'm sure Michael can talk to you about what you need to do with your investment portfolio and what kind of market it is and whatnot. But that's not where I think we get into trouble. I think we get into trouble where we go 100 miles an hour on the Autobahn, and then all of a sudden we're on some desert island where there's potholes and no directions. That's not healthy. And so how do we do that differently? So I tell people, and I'm not completely in jest, is if you are contemplating it, it's probably worth a session or two with a coach to help you do some of that reflection, unless you're really good and driven, or you have a spouse that can walk you through it, or a minister or whatever. But to have somebody that's not judging, that can just hear you out and help you organize what's important to you, I think will give you that vision to see what you might go to, and to not be so busy looking backwards that you're looking at the closed door, that you miss the opportunity in front of you. And we've talked about that metaphor. How about that? I could pull a metaphor.
Rob's using metaphors, everybody. You can do it too.
That's right.
Well, and you brought up this point in conversation too. Folks like Tom Brady or Michael Jordan or Kobe Bryant, Steph Curry, they have coaches too, right? Some of the most highest performers don't just have one coach, not just a head coach, but a hitting coach or a throwing quarterbacks coach, right? They've got nutritionist coach, they've got dietitians, they've got coaches all around them, and they're leaning on that expertise to become the best version of themselves that they can be. And when we look at that retirement journey, you mentioned it, being on a deserted island, the language we use in the Health and Wealthness book is a blank slate. Retirement demands that you have a sense of agency over your life that really rusts over time, when all of the behaviors you mentioned, being on call 24/7, the framework of your life is so rigid during the practicing years. And in retirement, you get to design that next phase. And so I think that's a perfect place to leave off for today, Rob. We'll close out by just saying you've done a phenomenal job with your retirement transition. And that's not to say it didn't come without its own set of unique challenges. So to think that there's this one size fits all solution is probably beyond reality. Perfectionism, be darned. Go out there and do just a great job and roll with the punches.
Well, I didn't go alone. So there's no journey that's singular. And again, we're taught to be fiercely independent, at least those of us are approaching the retirement age. That's the characteristic of most of the boomers. But other people have those same feelings and needs. And as you stated earlier, Michael, it probably is a good idea to let them know that you can be vulnerable too, and you're not alone. So suffer in silence is the way we were taught. Suck it up. Sleep is for wimps. All those truisms that when I look back on, it's like, well, I guess it helped me survive every third or every other night call, but I'm not sure it was really a very good thing in general.
Yeah, skills learned for a certain application that maybe don't have the same application now. And so with that, Rob, thank you for sharing about this period of retiring and bringing us up to the day that you retire. It was a powerful story. Thank you.
Well, I'm grateful for the opportunity to share it.
Thank you. And we'll talk to you next week.
All right. Look forward to it.
Thank you for listening to this week's episode of the Health and Wealthness Podcast. As always, I'm your host, Michael Swartz, Certified Financial Planner and Master Certified Physician Development Coach. If you're looking for additional resources for integrated physician retirement planning, please visit healthandwealthness.com. We'll see you in the next episode.